Smile. Oh.
Look at that.
Oh. Great. Oh my gosh, it looks so good. You like? Oh.
Moments like this are truly special. The work we do in dentistry can be stressful at times, but it's incredibly rewarding to know that we're making a real difference in people's lives. Hi, I'm Dr. Coup from North Texas Dental Surgery, located in the Dallas-Fort Worth Metroplex. Recently, a patient told me, "Hey Dr. Coup, I love to watch how you perform your all-on-4 procedures." And honestly, I can relate. If I were having a procedure done like a hair transplant, I want to see how my doctor performs the surgery too. We're always looking for fresh content to share, so I want to thank that patient for the idea. Today, I'm presenting my last smile transformation case from 2024. In my opinion, this is one of the most dramatic smile transformations at our practice. Mr. M is 63 years old. Over the last few years, he's lost 70 pounds by walking 5 miles a day and improving his diet without using Ozempic or undergoing surgery. However, he struggled with dental care for many years due to severe dental anxiety and negative experiences with past treatments. As you can see, Mr. M came to us with only 5 natural teeth and 2 implants, one of which didn't even have a crown. Growing up, his family made the decision to extract teeth rather than restore them, which led to significant dental problems. This 3D scan shows uneven bone levels, which are a common problem when teeth have been missing for a long time. Now that Mr. M has made significant strides in his physical health, he's decided to take control of his dental health too. He wants to fully enjoy his golden years, not just with a great smile, but also with the ability to chew properly and smile with confidence. Our plan is to restore his smile by placing 6 implants on the upper jaw and 4 implants on the lower jaw to support a brand new set of teeth. There is no single correct way to approach cases like this. Some doctors might agree with my methods and some might not, and that's perfectly okay. If you're considering this type of dental work, I highly recommend getting multiple consultations. That way, you can ask questions and choose a dentist who makes you feel the most comfortable. Now, let's dive into the planning and how we approach these procedures. Looking at Mr. M's 3D scan, you can see that his bone structure is uneven in both the upper and lower jaws. On the left side of his mouth, there's an implant with a crown, but you can see significant bone loss around it, exposing the implant threads. On the right side, there's another implant, but it's missing a crown, and the implant itself is buried under gum tissue. There's also a noticeable bone defect in the middle of his lower jaw, which will need to be corrected to make sure his new teeth fit properly. In this case, reshaping the lower jaw will be the most challenging part of the surgery. I need to create a smooth, even surface while not over reshaping the bone. I'll also use some key reference points like his facial lines, called the allotragus and the interpupillary lines, to make sure everything's properly aligned. For the upper jaw, I'm mainly concerned with ensuring that the bone around the sinus area is reshaped carefully. We don't want to risk causing a chronic infection by overworking that area. I also need to reduce the bone in the front of his upper jaw to create enough space for the new teeth. When it comes to implant sizes, I typically use smaller implants in the front teeth, so 3.8 millimeters, but for tilted implants at the back or pterygoid implants, which are the implants placed near the back of the mouth, I go with slightly larger ones, 4.0 or 4.5 millimeters. The goal is to ensure that there's enough healthy bone to support the implants long term. If the bone is too narrow in some places, I have to sometimes adjust my planning to work around it. A common question we get is about the difference between FP3 and FP1 teeth. FP1 refers to a more natural looking set of teeth, so the white portion only, which would typically require abundant bone to support it. In Mr. M's case, because of significant bone height loss resulting from losing teeth, FP1 are not a viable option. Instead, we're going to give him FP3 teeth, which are still an excellent choice and will give him a great smile. Now, let's walk through what actually happened during the surgery. First, we made sure Mr. M was completely numb and comfortable before starting. I began by gently lifting the gums to expose the bone underneath, a process that always takes a bit longer when the area has been without teeth for a while. Once the gums were pulled back, I carefully marked the areas where I needed to reduce the bone. I used key reference points such as the natural lines of his face to ensure everything stayed symmetrical. The front teeth were easy to remove, but the molar at the back required more careful extraction. I divided the molar into sections to avoid breaking off any unnecessary bone, which can sometimes happen when you pull out a tooth too quickly. Next, I reshape the bone, which is a crucial step for making sure the implants have a solid foundation. It's a bit like sculpting. It requires precision and patience. Too much reshaping can be just as bad as too little, so I make sure to check my work frequently along the way. Once the bone was properly reshaped, I began placing the implants. I started with the back implants near the sinuses, which are often tilted to fit into available bone. In Mr. M's case, the bone in the back of his mouth was thinner than expected, so I had to adjust my approach with what's called a palatal approach and place the implants in a way that ensures they stay secure long term. After the back implants were in place, I moved to the front. Then, I placed what's called pterygoid implants all the way in the back. These anchor to the specialized bone called the pterygoid plate and give added security to the new teeth. I used my experience and tactile sense to ensure that the implants went in straight and secure, and each one was properly torqued into place. The multi-unit abutments, also known as MUAs, are then placed on top of the implants. These abutments act as the connectors for the final teeth. Then, we use a technology called photogrammetry to take extremely precise measurements of the implant positions. This allows us to map the exact location of each implant in 3D space, which helps us design the most accurate prosthetic teeth. We then use this data, combined with scans of the gum tissue, to create the patient's new smile. Afterward, I stitched up the gums and made impressions to ensure the bite and alignment were perfect. Once everything was set up, the lab team went to work creating Mr. M's upper temporary teeth. This step was followed by the lower surgery. I followed the same previously mentioned steps to make a matching lower set. After they were ready, we numbed the patient again and placed them. There was only a small amount of bite adjustment needed thanks to the hard work of our lab team. Here's a quick look at the post-surgery 3D scan. I'm pleased with how everything turned out. The lower teeth are a bit thicker than expected, but that's due to the pre-existing bone loss we had to compensate for. The most rewarding part of this entire process, however, was seeing Mr. M's wife's reaction when she saw his new smile.
Alright, we'll see you today. Thank you, absolutely.
Let me see.
Look at that.
Smile. Oh.
Look at that.
Oh. Great. Oh my gosh, it looks so good. You like? Oh.
Thank you for watching, and I hope you learned a lot from this case study. If you're interested in learning more about dental implants, procedures, or just want to see more of our transformations, make sure to like and subscribe to our channel. I'll continue to release more case study videos in the future. If you have any questions or comments, feel free to leave them below, and we'd love to hear from you. We're most active on YouTube, but you can also follow us on Instagram at North Texas Dental Surgery, and TikTok, our handle is NT Dental Surgery, for more behind-the-scenes content. Thanks again, and have an amazing week.